It has, Mr. Chairman.
Without objection, the amendment will be considered as read, and I recognize the gentleman from Texas to explain his amendment.
I thank the gentleman for recognition. Now, in the base bill in front of us, 3200, it recognizes the formula under which we reimburse physicians under the Medicare system, under the sustainable growth rate. It cuts Medicare payments on a nearly annual basis, and it has to be fixed. But as far as the base bill goes, it still puts physicians in this country in a position where they could face yearly cuts with a formula that is still fundamentally inexorably linked to the gross domestic product. And as we all know, the gross domestic product has been declining this year. Therefore, physicians could anticipate a reduction in reimbursement based in a formula based on gross domestic product. The amendment that I'm offering builds off of the base bill to give physicians and patients what they really need: a stable and reasonable predictor of an inflation of reimbursements that are subject to inflationary pressures. This amendment is going to do a great deal of good for patients and for the doctors who provide for them. It will keep current law for 2009. That's the bad news, but the good news is it will rebase the sustainable growth rate formula in 2010, providing a modest increase, and in 2011, switch to an update that is linked to the Medicare Economic Index, a cost of living index, if you will. Now, as you know, Mr. Chairman, the doctors are scheduled to receive a 20% reduction in payments if we do nothing by the end of this year. Trustees for Medicare have projected Medicare payments to doctors will be cut by several percentage points if Congress does not act. Consider this. Doctors who are seeing our most vulnerable patients, our senior citizens, will face a cumulative cut of 25 to 35% over the next 5 years if we do nothing. But imagine what that's going to mean for those who depend upon the Medicare system for their medical care. These increases are coming as a result of flaws in the Medicare formula created by the Congress, and there's almost universal agreement that increases rather than decreases are necessary, and that this formula is a mistake by Congress, which we've not yet been able to successfully fix. We all hear about new Medicare beneficiaries finding it difficult to find a doctor that will take Medicare. When seniors relocate, it can be a struggle for them to find a doctor who is willing to take them on. This is all because doctors around the country realize that Medicare is an unstable payer, subject to the whims of political will and influence, and are doing what they have to do in order to protect themselves and their businesses. Can you imagine going into your banker with a business plan that says, I'm going to expand my business? The banker says, well, what can you show me about the stability of your income stream for the years to come? What's this about a 20% cut at the end of this year? It's an untenable position that we put our doctors in this country. We need a permanent fix to the formula, and if now is not the time, when are we contemplating a bill that, if not now, when is a better time? We're contemplating a bill that costs almost $1 trillion over 10 years, perhaps even more than that. This is the correct time to provide that fix. When can we tell our country that their doctors will not have to live under this sword of Damocles every year that may result in cuts in their reimbursement? This amendment is about priorities. A vote for this amendment is a vote for the nation's seniors. A vote against this amendment is a vote for the status quo. And we all know our President has said the status quo is not acceptable. So with that, Mr. Chairman, I thank you for the recognition, and I'll yield back the balance of my time.
Gentleman yields back the balance of its time. Who seeks recognition on this amendment? Mr. Braley.
Mr. Chairman, I'd like to remind my friend from Texas that that sword of Damocles was raised over the head of physicians in this country by a Republican-controlled Congress. This bill provides a comprehensive permanent overhaul of the SGR that falls within the pay-go adjustment allowance. And this House is committed to passing a statutory pay-go, and one of the baseline adjustments in our legislation is for the sustainable growth rate, the update mechanism for physician payments in Medicare. That adjustment allows us to make a $245 billion change without applying the normal pay-go rules. Repealing the SGR formula in favor of permanent updates would add about $60 billion in cost to this bill. And our bill, H.R. 3200, provides incentives now for the provision of primary care services and the formation of accountable care organizations. This amendment undoes all of that. Paying for health care reform, as we all know, is a heavy lift, and every dollar of spending added is another dollar we need from revenues or program reductions elsewhere. The SGR reform in the bill is the responsible path. It wipes the slate clean and reforms the system, but does it in a fiscally responsible way. And I would also note that the update for 2010, based upon the Medicare Economic Index, wipes away accumulated deficits to provide for a fresh start. It also excludes items not paid for under the Medicare fee schedule, like prescription drugs and lab services. It provides an extra growth allowance for primary care services and encourages accountable care organizations to take responsibility for quality and cost. And Mr. Chairman, we've worked hard to move the cost curve by promoting a change in the way Medicare is paid for, moving from a quantity-based toward a quality-based system. This amendment would go in the opposite direction, and that's why I oppose it, and urge my colleagues to oppose it as well.
Further discussion of the amendment. Mr. Barton.
And I'll be very brief, Mr. Chairman. This is a put your money where your mouth is amendment. Both sides have said they want to fix the SGR system. This does it permanently. There are no gimmicks. It puts in place an MEI index that's adjusted for inflation each year. The PAYGO bill that passed the floor last week doesn't require, exempts this particular amendment from PAYGO, but we feel like that it would score the cost over 10 years of this amendment, we believe, would be in the $300 to $340 billion, or say $34 billion per year. We also believe if we had to come up with cost savings, even though it's been exempted under PAYGO, that we could do that. So this is a straightforward, if you really are telling your doctors that you want to fix permanently the SGR, then this is the amendment to vote for, to tell them that you're really going to do it. And with that, I yield back.
Gentleman yields back the balance of his time. Ms. Capps?
I want to just add on to, I won't repeat what my colleague from Iowa has said, in opposition to the amendment and in favor of what the underlying bill does in the way of SGR reform, which is substantial and is paid for. This amendment is not fiscally responsible. We have included the structure that several groups, I will include for the record, but including the American Medical Association and some other groups as well. There's a huge list of them. I'm only going to pick out 3 or 4. The American College of Obstetricians and Gynecologists, which I think the amendment author knows something about, and the American College of Physicians and the American College of Surgeons. I will leave it at that and yield back to someone.
Generally yields back well, if you yield to me, I join you in opposition. This amendment would add $60 billion to the cost of the bill, and I have not seen a way to pay for it, and I join my colleagues who have urged that we defeat the amendment.
Mr. Chairman.
Mr. Burgess, I'm going to recognize you to close on your amendment, and then we'll proceed to a vote.
Very, very briefly, 2 things. First off, we talk about what this costs. The reality is this money is not sitting in an account somewhere drawing interest. This money has already been dispersed. If we were a private company and carried our books this way, we'd all go to jail. The other thing is on the groups that have endorsed this bill, I suspect if you ask any member, any physician member of the ACOG, American College of Obstetricians and Gynecologists, or the American Medical Association, if they would favor a permanent repeal of the SGR and delinking it from the gross domestic product, I don't think there's any question of what they would tell you. And finally, do not forget that everything that is done within the Medicare system, the private sector bases their reimbursement formula on what we do in Medicare. So it is not just a Medicare issue. This affects Cigna, United, Blue Cross, all of the healthcare companies out there that also provide reimbursement for our physicians. They're going to base their formulas off of what Medicare does. So this is the implications are not just for Medicare. They are far-reaching throughout the medical profession in this country. And I'll yield back.
Are we ready for the vote? All those in favor of the Burgess Amendment say aye. Opposed, no. No.
Mr. Chairman, I'm going to ask a roll call vote.
Okay, let's proceed to a roll call vote.
Mr. Waxman.
No.
Mr. Waxman votes no. Mr. Dingell. Mr. Dingell votes no.
Mr. Markey. Mr. Boucher. Mr. Pallone. Mr. Pallone votes no. Mr. Gordon. Mr. Rush. Ms. Eshue. Ms. Eshue, no. Mr. Stupak. Mr. Stupak, no. Mr. Engel. Mr. Green. Ms. DeGette. Ms. DeGette votes no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Ms. Harmon. Ms. Harmon, no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Gonzalez, no. Mr. Inslee. Ms. Baldwin. Ms. Baldwin votes no. Mr. Ross. Mr. Ross, no. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Mr. Butterfield. Mr. Butterfield, no. Mr. Melanson. Mr. Melanson, no. Mr. Barrow. Mr. Barrow, no. Mr. Hill. Mr. Hill, no. Ms. Matsui. Ms. Matsui, no. Mrs. Christensen. Mrs. Christensen, no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes.
Hey, how are you?
Mr. Sarbanes, no. Mr. Murphy of Connecticut. Mr. Murphy, no. Mr. Space. Mr. Space, no. Mr. McNerney. Mr. McNerney, no. Ms. Sutton. Ms. Sutton, no. Mr. Braley. Mr. Braley, no. Mr. Welch. Mr. Welch, no. Mr. Barton. Mr. Barton votes aye. Mr. Hall. Mr. Hall, aye. Mr. Upton. Mr. Upton, aye. Mr. Stearns. Mr. Deal. Mr. Deal, aye. Mr. Whitfield. Mr. Whitfield, aye. Mr. Shimkus. Mr. Shimkus, aye. Mr. Shattuck. Mr. Shattuck, aye. Mr. Blunt. Mr. Blunt, aye. Mr. Boyer. Mr. Radonovich. Mr. Radonovich, aye. Mr. Pitts. Mr. Pitts, aye. Ms. Bono Mack. Ms. Bono Mack, aye. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mr. Sullivan. Mr. Murphy of Pennsylvania. Mr. Murphy, aye. Mr. Burgess. Mr. Burgess, aye. Ms. Blackburn. Ms. Blackburn, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Scalise. Mr. Scalise, aye. Mr. Markey. Mr. Markey votes no. Mr. Rush. Mr. Rush, no. Mr. Inslee. Mr. Inslee votes no. Mr. Green. Mr. Green, no. Mr. Stearns. Mr. Stearns votes aye. Mr. Matheson. Mr. Matheson votes no.
Have all members responded to the call of the roll? Any member wish to change his or her vote? If not, the clerk will tally the vote. Yes.
On that vote, Mr. Chairman, the yeas were 20, the noes were 32.
20 ayes, 32 noes. The amendment is not agreed to. Mr. McNerney, do you have an amendment?
Yes, Mr. Chairman, I have an amendment at the desk.
Before the clerk reports it, will she inform us whether the amendment is to this title and has been available for 2 hours?